You're welcome back. This is Sunday Breakfast on ChannelOne TV. Joining us for the health conversation, Dr. Kalsum Zakaria Adams, who is a public health practitioner and specialist maxillofacial surgeon. Remember, we started a conversation on cervical cancer last week, January being the month for that, and we're going to continue that conversation today. If you have any questions, any suggestions, any thoughts, do send them to the WhatsApp number 0204 447 033, 0204 447 033. Alternatively, you can use X or other social media platforms with the hashtag Sunday Breakfast, or my handle, ino_s, Jude's handle at Mensa Duncan, and we'll read them here for you. Doc, you're welcome.
Thank you.
How are you doing? I see you brought some
Very well.
some props.
Yeah.
And the men in the studio were excited.
Just to make it more practical.
Okay, so that we know what we're talking about.
Yes, to demystify the fact that people think that, oh, getting a pap smear done is painful and it's very invasive and all of that. So just to demystify that and then make people comfortable to walk into the clinic and have a pap smear done.
Pearl, did you hear that?
Yeah, there's a funny social media video about, doctors who deal with some of these things, right? And they're like, the video was saying that, you go to the guy, right? And he's like, giving you a privacy to change and everything. Then the next minute,
He's all up in your business.
It's actually a video, you should see it. It's so funny.
Oh, really?
So they do the curtains thing in the video. Then the next time, the camera actually zooms in on the guy's face as though it was, it's crazy.
But it's usually done with chaperones.
Okay.
Yes, for medical legal reasons.
Medical legal.
Yes, so if it's a male who is going to see you, you definitely will have a chaperone there.
Okay.
So that it is done under ethical conditions and there are no issues with it. So our patients are safe.
Absolutely. Particularly for Kolobu, I can vouch for Kolobu.
Yes.
So,
we spoke about cervical cancer. Let's just refresh our minds before we delve into the pap smear.
Okay, all right. So cervical cancer, we started this conversation last week, and we mentioned that the cervical cancer has to do with you having a cancer or having cells within the cervix dividing uncontrollably and then spreading to other parts of your body. And the cervix is hidden. So it's a hidden part of the female reproductive system. It actually protrudes into the vagina. So it is that little neck that connects the uterus to the vagina. So that little area there, when you have, most of the time we see about 70%, 90% is associated with exposure to high-risk HPV infection. So when you have this happening and then causing changes around the cells of the cervix, and then it becomes cancer, then we say that we have cervical cancer.
Okay.
And we also went on to talk about some of the risk factors associated. We mentioned having multiple sexual partners, or having a partner who has multiple sexual partners puts you at a higher risk of developing cervical cancer. And then also having early coitus, so having had your first sexual intercourse at an early age also predisposes you to getting cervical cancer as opposed to somebody who was not exposed at that early age. And of course, good old smoking and alcohol use also reduces your immunity and then also puts you at a higher risk of developing cervical cancer. And you also having some STIs already, so it could be syphilis, gonorrhea, also predisposes you to developing cervical cancer. And then reduced immune states too. So reduced immune states, it could be that you have an already existing cancer somewhere in the body, or you're undergoing some cancer treatment like chemotherapy or radiation therapy, or it could be that you have the retroviral infection, which is HIV. So all of these are some of the few factors that we spoke about that would predispose you to getting cervical cancer. Wow. And we also went on to talk about signs and symptoms.
I remember.
And we mentioned that cervical cancer takes a long time to develop. So we have the evolution of cervical cancer. It starts from an infection, so normal cervix, and then it's exposed to the HPV infection. And then from the infection, if it doesn't clear spontaneously, and then it moves to chronicity, then it means that you may end up with precancerous lesion, and this precancerous lesion can also end up becoming cancer. And we mentioned that this takes a long time, 5 years, 10 years, 15 years, 30 years. And that is why we are emphasizing on screening modality, so that people come out and then screen, so that within this period, before you get to full-blown cancer, you would have been able to catch the disease early and then nip it in the bud. So some of the signs could be that you don't have any signs at all, but the disease process has started, or you have the infection there, or you have the precancerous lesion there, no signs at all. And it's important that you go and then you have it checked, so that once it is checked and you are positive, the appropriate treatment is given. Another sign that the patient may present with would be having a foul, smelly vaginal discharge. Yes, that's one of the symptoms that the patient may present with. Or having bleeds in between your regular menstrual bleeding. That is also another classical sign. And then postcoital bleeding, that's bleeding right after having sexual intercourse. So I'll show a few pictures that will throw more light on this, looking at where the lesions would be, and then the thrusting that would result in you having bleeding that we term postcoital bleeding. And then also, depending on the stage of the tumor, it could be that it may have moved to other parts of your body. So whichever system that it has affected, you may have signs and symptoms associated with those systems or organs that are involved. And then the bleeding, because of the constant bleeding, you may end up presenting very anemic, and with all the weakness and then the signs and symptoms associated with anemia. And then because it's a cancer, it tends to predispose you to losing weight, which we call cachexia. So you become cachexic as well. So these are some of the few signs and symptoms that the patients may present with. And it's important, as we mentioned, that cervical cancer is one of the #1 cancer deaths that results in cancer deaths of women. And it is a highly preventable cancer. So why do women have to die from it? And it boils down to lack of knowledge. A lot of people do not know about cervical cancer. It also boils down to some of our traditions, because people don't want to talk anything reproductive, because they feel that it's a taboo to talk about your reproductive system. So people do not want to even go there. So we need, as health workers, to come out there and then talk to people about cervical cancer, especially in January, because January has been dedicated to cervical cancer awareness. And it's important that we all join in and then let people know about cervical cancer, so that they do not die from a preventable cancer.
I mean, for me last week, it was really shocking to hear that it's one of the leading causes of death amongst women, in Ghana. And I like the fact that we've taken this whole awareness month, Wow. So for today's discussion, we are continuing the same discussion we started off, just that we are going more
into
practical.
the screenings.
Wow.
Yes.
So what do we have in front of us? And
so
I'm not sure why it's facing Eno, but it is, no, thank you. No, thank you. No, thank you. In any case, I don't have one, so I was thinking I would get to see what it exactly was. But Doc, talk to us. I think our viewers should
be able to see it. All right.
So
all right. So this position should be fine. All right. So this is just a dummy.
Okay.
And then showing the position that the lady would be put in for the screening. So before I go into it, we have different screening modalities. We have the pap smear, we have the VIA, and then we also have the co-testing, which will test for the HPV DNA. So the lady is placed in this position with the hips flexed this way. So the reason is just for more vision, for you to be able to see as much as possible. And mind you, the cervix is hidden. So because the cervix is hidden, and it is usually the vagina has the anterior wall and the posterior wall, which are collapsed on each other. So you need a speculum, okay, to be able to open up so that you can now visualize the cervix. So this is just a dummy showing the position, lithotomy position, and then the fact that a speculum is going to be inserted. Yes, so that it can part the anterior wall and the posterior walls of the vagina so that you can visualize the cervix. So now, when you do open up the vaginal walls, you would visualize something like this. So this is the womb. This is just a dummy, again showing. So this is the uterus, or this is the womb, and this is, let me use this instead. So this is the womb, and then this is the vaginal canal, and this is where you find your cervix.
Okay,
which
so
is
it's
in
inside.
there. Yes, so usually it's collapsed this way.
Okay.
Okay, so because it's collapsed this way, you need something, a speculum, to open it up. Unfortunately, I didn't bring a speculum, but I have pictures of it that I can show. So a speculum is just an instrument. Usually we use the disposable ones. Yes, so that does it there. So usually you use the disposable ones, and it's plastic, so it goes in. It's not painful. It goes in, lubricated. It goes in, and then it opens up the vaginal wall this way, so that you can visualize the cervix, which is hidden in here. It makes sense, right? Okay, so this is the womb, as I have mentioned, or the uterus. This is the vaginal canal, and then the cervix is the neck to the womb, and it's hidden in here. And then these are the fallopian tubes, and then your ovaries will be on the sides and all of that will go in. All right, so once the speculum has gone in and has opened up, we are likely to see the cervix, and this is how the normal cervix looks like. So there's also another picture of the cervix, a normal cervix that we can all see. So you expect to see pink, healthy tissue, okay, with a small hole there, just like this. So the pink, healthy...
What do we have on our screen right now?
Yes, yes,
Is that
exactly.
what you're talking about?
Yes, exactly what I'm talking about. So you will see a pink, healthy tissue with a small hole in the middle. Okay, so this pink, healthy tissue, usually that small hole, we call it the external os. And there's another hole that is within, inside, that is the internal os. So when the HPV, or you have an infection that's the cervix is exposed to, you see the area around that small hole that I just showed, we call that the squamocolumnar junction. The squamocolumnar junction. Okay. So this squamocolumnar junction, this is where usually cervical cancer or changes start. So if the HPV infection affects this area, what happens is that it starts to cause changes if it doesn't clear over a period of time. So those changes, we call them dysplastic changes, and these dysplastic changes will become precancerous lesions, and if nothing is done about it, would end up becoming cancer, full-blown cancer. So when you open up, this is what you expect to see: healthy pink tissue, shiny, no growth, and then you have your small hole there, which is your external os. So you inspect all of these areas when you open up. Now, as opposed to another cervix that you may see when you open up, you notice that there's another picture that I want to show. That there are times that you may end up seeing these cervix. So you can see that this is different. This is just to demonstrate. You can see that this looks rough. It looks like there's a growth there. It looks like there's some bleeding. the small uniform hole that we saw with the normal cervix, you see that this is different. So this is actually a diseased cervix. And this, we don't want. A lot of people end up coming in this stage. We don't want people coming in this stage because it's far advanced. Even though it looks small here, but the distraction, trust me, is far advanced than you can imagine.
That's the pre-malignant.
Is that what we're seeing on?
So this is a pre-malignant lesion, or it can end up even being cancer, depending. So pre-malignant lesions, so it's just a stage. So pre-malignant lesion, if nothing is done about it, will undergo more changes and then end up becoming cancer, full-blown cancer itself, which is cancer in situ, depending on where it has affected, which part of the cervix it has affected. And then you can also stage it for you to be able to tell whether it's stage 1, 2, 3, 4, and then whether once it's 1, 2, or 3, 4, you would know whether it's early disease or it's late disease. And depending on this, you would know the kind of advice you give to the patient, whether surgery or may end up going for chemotherapy or radiation therapy or palliative. So depending on where it is. So this looks far advanced, what I'm holding now, far advanced. You can see that there's an exophytic, so it's like there's a growth outward, an exophytic lesion out there around the cervix. You can see that the round, small external os has been lost, and now there's a sore there, and this sore would end up, if let's say this patient is still or has sex, ends up having sex, so you notice that the penis hits directly on this. So if the penis hits directly on this, you know that there'll be bleeding. The cells here will be friable, and then you end up having bleeding. So that's where the symptom of postcoital bleeding that I mentioned comes in. Yes, so this is a cervix that is diseased. So from our dummy and what I have shown here, you can see that, so this is just a demonstration to show that maybe you're using a speculum, which I didn't bring here, but I showed a picture of it, to parts, and then show the, for you to be able to visualize how the cervix looks like. So for you to have a pap smear, or for you to have a VIA, so VIA is nothing but visual inspection with acetic acid. So it is one of the screening modalities for diagnosing precancerous lesions, for diagnosing cancer, and for screening for cervical cancer in general. So what you do is that once the patient is in this position and the speculum or the cervix has been exposed, you would use 4% acetic acid on the cervix, on the surface that I showed. You would just use that 4% acetic acid, you dab it, and then wait for about 2 minutes. So when you wait for about 2 minutes, you would see this aceto white lesion. So just a white patch there, just to tell you that maybe there's something wrong. So we have a picture of it as well that is showing on the screen, where you have this patch. So if you have this patch, it's likely that it's a positive, test. Okay. And depending on what you see, you can have treatments there and then. That's the advantage of doing a VIA, that you can screen and treat at the same sitting. It is widely available in almost all hospitals. Okay, even in the rural areas, you would be able to do, because all you need is your acetic acid, which is widely available. And then the next one would be your pap smear. So your pap smear, what it does is that after you expose the cervix using your speculum, you would then take some cells. So there's a picture of that as well. So you take some cells. So you're going to take some cells from, if we remember, from this cervix that I mentioned, you would take, this one rather. Okay, so I can use this one. So you take some cells from the external os, Then you take some cells in the endocervix as well, which is within. Remember I said there was another hole inside. So you're going to use a spatula to take some cells. So you're just swiping around it, 360. And then you put it on a slab, a glass slide, okay? And then you take that sample too from the endocervix, and then also put it on the slide. And then you take it to the lab for examination under the microscope. So that is the pap smear. So once it is examined under the microscope, a report will be written down as to the morphology of the cells, and then you would be able to tell if the patient has any precancerous lesions or has any dysplastic changes or has full-blown cancer, depending on what is found there. So all of these screenings are not painful, and they take maximum, I would say, 7 to 8 minutes to have this done. Positioning the patient, letting the patient know that establishing rapport with the patient. Once that is done, the patient is comfortable, then you get your speculum, and then with permission, you let the patient know that it's just going to be a little uncomfortable because you're going to part the walls of the vagina using the speculum to be able to visualize your cervix. Once you do that very comfortably, then you take your samples, if it's a pap smear, or you do your dabbing with your acetic acid, and then you check there and then screen treat, and then you move on. The other treatments is the same thing, just like a pap smear, just that there will be other microbiological testing that will be done on the samples that are taken, and that would be able to tell you if there's HPV present, and through PCR. So that is usually the co-testing. So these are the 3 treatment modalities, and we mentioned that if you do a VIA or you do a pap smear, ideally every 3 years if you have a negative test. But then depending on what is found at the moment, you may have a shorter screening schedule. If it is the co-testing with tests for the HPV DNA, then that is every 5 years, as we have mentioned. So basically that is it, and I'm sure that we are not scared anymore. Are we?
That question is to the ladies in the PCR.
I'm
You're
sure
not
we are
scared
not
anymore,
scared
are you?
anymore, because it's painless. Trust me.
It's painless.
Painless. It's just a little uncomfortable when you are parting or you are passing the speculum. That is all. That's the only discomfort. And then the only thing...
She doesn't trust that it's not
You know,
painful.
I also feel for people, I don't really want to speak for women, but I get the sense that the whole invasion, intrusive, I think is the word.
Yeah.
It can be quite intrusive, right?
Not exactly. Because all you're doing is you're just parting the vaginal walls to see the
What is
cervix.
inside?
So as I demonstrated with this one,
Yeah.
where you have, this is how it looks actually inside. So everything is hidden.
So, but it's being watched on the screen, right?
Yes. No, not on a screen.
So it's,
Yes, with light source.
wow.
Yes, so with light source, it's this way. You just open it up this way with a speculum, and then you visualize with light source.
Okay.
Once you visualize with the light source, you'll be able to see the cervix, and then you take your samples, or you do your VIA if you have to do. So it's not, and by the time, once you do it, quickly take your samples for the pap smear. You remove it, and that's it. Yes.
Hey, you're saying this so like casually, like.
It is not
It's
painful. It's
I've
not.
done it before. I've done it severally, actually.
Yeah.
It's not painful.
I want to
A bit
use
uncomfortable,
this
but
platform to admonish a lot of our, young ladies, our friends, sisters, colleagues, to get it done.
Yeah.
Yeah.
I think it's
Very
better
important.
safe than sorry.
Yeah.
You might as well get it
Because
done.
as we said, you see,
Yeah.
when we looked at the cervix that looked diseased, you can see that it looks very diseased. There's a lot of, I think I have a picture of that as well. Can we see the abnormal cervix picture?
An
on the
abnormal
screen?
cervix.
Yes. Okay. So looking at this, if you cast your mind back, the first picture we showed, that picture looked there was healthy tissue. There was no growth. It was all healthy and pink. You had a small hole, which we call the external os showing. But then as opposed to the next picture, where there's a growth, you can see that there's something, there's an exophytic growth there. The shape of the external os has distorted.
Yeah.
Okay, and then it looks very pale as opposed to the healthy one. You get it? So this takes time, and these are the changes we were talking about. It just doesn't happen after a day. It takes time. It takes 5 years. It takes 10 years. It takes 15 or 30 years, all of these. And it's a lot of time. It's a lot of time. If you are doing your screening every 3 years, you would be able to catch this early.
Yeah.
Even before it becomes this big, or it becomes this precancerous lesion and then tends to become cancer proper itself.
Yeah.
You get, so it's a lot of time. It's a cancer that is preventable, but it kills. So how do we prevent it? The only way to prevent it is to do your screening. That's if you are looking at secondary prevention. Primary prevention is another thing which we'll talk about maybe another time, which would be the vaccinations and all.
Oh, there are vaccinations too?
Yes, there are vaccines for the HPV.
Oh, okay.
Yes,
okay.
which
okay.
you can have for both males and
I think
female.
you mentioned that before.
Yeah, the last time. So
cool.
it takes time. It takes a lot of time before it becomes this big.
But the
Or
early
it becomes-
detection
yes,
is what saves
will
lives.
save your life.
There's some
Early
questions here for
detection
you.
will save your life.
Good morning. I'm Abdul Hakim from Northeast. How will you, what will you do if you have intercourse with your pregnant wife and later on she's bleeding? That's the question.
Okay.
Should I read the other one?
Yes.
Okay, good morning. Thank you for the educative program. Kindly find out from doctor the dangers of HPV when you engage in oral sex.
Okay. All right. So I'll start with the second one. So yes, oral sex. Remember the last time I mentioned that because of change in sexual practices, people are having more oral sex, and we are seeing a lot of oropharyngeal cancers now. So the HPV, the same changes it's going to cause to the cervix of the patient when that cervix is exposed to, is the same changes it's going to cause to the oropharynx. So the oropharynx is just behind the oral cavity. Yes. So that area can also become cancerous. You can end up developing a cancer of that area. And actually, HPV has a high link to oropharyngeal cancers. So it's a high risk factor for developing oropharyngeal cancers. So that's why this education has to go beyond the cervix. We have to talk about the oral sex as well, and then let people know that if we are leaving the cervix and we are going to the mouth, yes, we have the chances of developing oropharyngeal cancers as well. Yes. And then the second question
was asking if you have intercourse with your
Bleeding.
pregnant wife and later on she's bleeding. What it means?
So what I would say is that this patient should see, if it's persistent, should see his or her gynecologist for further examination, and then yes, further examination, and then advice as to what is found there. Yes, but definitely, it's not something that we want to see.
Mutarin Tamale wants to know if cancer affects pregnancy.
Cancer affects pregnancy. Yes, cancer would affect pregnancy in so many ways. So if cancer, as we said, it depends on the part of the body that you develop the cancer. So you have cells in a particular organ, starts to develop because there are changes, maybe DNA changes or any other aberrant changes within the cells, causing the uncontrollable division of these cells, and then it becomes populated in that cell, in that region, and then it moves to other parts of the body. Yes, it will affect what was it, pregnancy,
Pregnancy,
right?
yeah.
Yes, it will affect pregnancy in the sense that pregnancy itself is a physiologic state. And during pregnancy, you have hormonal surges. You have different hormones that may otherwise may not be high in a normal state. So these hormones tend to also feed into some of these cancers. And then it makes it even worse. So for instance, in breast cancer and in pregnancy, you tend to have the cancer becoming bigger in pregnancy. And mind you, when you are pregnant, there are certain procedures you would not want to do. So let's say you not want to do, let's say, a biopsy, because if you do a biopsy for a patient who is pregnant at that stage, or depending on the trimester of the patient, you may end up causing the cancer to even proliferate more and more. So yes, cancer or pregnancy affects cancer growth to a very large extent, and we don't want the two of them happening at the same time.
Right.
Wow. Doc, thank you so much.
Most welcome.
I like it when you practicalize it like this for us.
Yeah.
Is there an equivalence of this for like males in terms of how to
There should definitely be, but I don't see why you would
need some.
Yes, but definitely, I mean, there should be.
Wow.
As for some of these dummies, yes, they are there for demonstrations, for teaching purposes, and to make things much more clearer for
And
people to see it and
yeah.
understand it, instead of just talking about it virtually, and they don't really practicalize and then see it. So it's available.
Amazing.
Yeah.
Wow, Doc, thank you so much. You also understand your
Thank you
maxillofacial surgeon.
Yeah.
Wow. Maybe just very brief words. If anybody wants to find, need your services for like some,
Okay.
how can they reach out? Where can they find you?
Oh, so that's in Kolebu Teaching Hospital. So maxillofacial surgery deals with from infections to cancers that affects the head and neck region, so the maxilla.
It makes so
and the
much
jaws.
sense.
Yeah.
The very first
Sets of
sets, when
Yeah,
we're doing
that
head
we
and neck,
were-
we're
exactly.
just throwing on the thing. You got all the information.
Doc was using us to refresh her books.
The information was overload.
Yeah, that's
It was
true.
way too much.
Yeah, that's true.
Wow.
So yes, basically that trauma, accidents, all of that we do, and then we'll fix once you have fractures in the maxilla, fractures in the mandible, we fix all of that.
Wow.
For you.
Doc,
Yes,
thank you so
basically
much
that.
for your time.
Thank
Grateful
you
for
too.
the public education and the
Yeah.
insights. Thank you so much.